Multiple mandibular exostoses. Multiple maxillary and mandibular exostoses are common localized overgrowths of the bone. Tori and exostoses are nodular protuberance of calcified bone and are designated according to their anatomic location. Torus palatinus and torus mandibularis are the two most common types of intraoral osseous overgrowth. Buccal and palatal exostoses are multiple bony nodular masses found less frequently than tori. As we can see in these three pictures, torus palatinus, torus mandibularis, and buccal exostoses, there is the palatal exostosis. The etiology of multiple exostoses remains unknown, although an increased occlusal loading of the teeth has been suggested. The most widely accepted hypotheses are nutritional disorders, heredity, mastication hyperfunction, and environmental factors. But there is no consensus about the etiology. So it is unknown, and these just the accepted hypotheses. The diagnosis part are so important to distinguish between the exostoses and osteomas. So, the diagnosis of apical exostosis is based on the clinical examination along with radiographic interpretations. Clinically, the torus may appear a numerous rounded protuberance or calcified multiple lobules, whereas the exostosis is a single smooth broad-based mass. So there is a difference between the torus and the exostosis. They are the same, they are both bone overgrowth, but they may be differentiated on a clinical appearance. Lesions may slowly enlarge up to 3 to 4 centimeters in greatest diameter, but it does not have malignant transformation potential. Important note, if the patients are having multiple bony growths or lesions which are not in the classic torus or buccal exostosis locations, they should be evaluated for Gardner syndrome. This is autosomal dominant syndrome, shows other features such as intestinal polyposis and cutaneous cyst or fibromas. So it's important to distinguish between bony overgrowth or lesion to rule out the presence of Gardner syndrome. Exostosis versus osteomas. Exostosis are benign bone growths, as we said. Osteomas are bone lesions with different onset and slow growth. Bony exostosis, peripheral osteoma, actually they sometimes look just the same, and if there is a dilemma in the diagnosis, we should take biopsy. Case report, a female patient who was aged 38 years reported to the Department of Periodontics for checkup and oral prophylaxis. On a clinical examination, she has a poor oral hygiene. Multiple bony nodules were found in the lower anterior region of her mandible. The patient had not previously noticed the nodules and she was otherwise healthy. Her medical history was non-contributory and there was also no history of any other family illness or any tissue tumors which were suggestive of any syndrome. So the medical history are important in these cases to rule out the presence of syndrome or any tumors. On examination, the patient was found to be apyrexic and there was no lymphadenopathy. Intraorally, intact dentition was present and all the mucosal surfaces appeared to be healthy. Multiple bony protuberance were evident along the labial aspect of the mandible, as we can see in this picture for the patient. The approximate diameter of the bony swelling varied from 1 to 1.5 millimeter. On palpation, 5 round, firm, raised, non-tender protuberance were diagnosed. So we take intraoral periapical radiograph as well as OPG for the patient, and as we can see, there is multiple radio-opaque nodules from canine to canine. And that is the radiographic finding. There is masses, radio-opaque, in the mandibular anterior region. Thus, the radiographic findings correlated with the clinical examination, and in light of these findings, a diagnosis of multiple mandibular exostosis was made. Treatment: no bony exostosis or tori requires treatment unless it becomes large enough to interfere with periodontal health, denture replacement, or cause recurrent traumatic ulceration. For this patient, it was just a protuberance with no symptoms or anything, so there is no specific treatment for her. But if she was concerned with the aesthetics of the protuberance and the treatment is elected, the lesions should be cut off or removed from the cortex using bone cutting pair or hand instruments. As a conclusion, an accurate diagnosis of multiple exostosis is important, and the exostosis should be distinguished from the osteomas, especially the exosteal osteoma, the organized subperiosteal hematoma, which is a mature ossifying fibroma that has caused expansion of the cortical plate, and early osteosarcoma or chondrosarcomas. These are the most probable lesions or diseases that we could be confused with bony exostosis. Thank you.